Hi, this is Dr. Doreste with the Cranial Release Technique. A happy Father's Day to all of you out there. And I wanted to just do a little bit of a deeper dive from a cranial release standpoint, linking cranial release and Father's Day. So here we go. Here's my attempt. When we were back in school learning everything there is to know about chiropractic, back in chiropractic school, I remember during embryology. And in embryology, we were learning about how a human being has one cell from dad, one cell from mom, comes together, makes a new cell. And that cell keeps doubling. And then at some point, the cell changes. And the first organ system that forms is the brain and spinal cord. And from the brain and spinal cord, kind of like a trunk of a tree that you see in the background here, if you can imagine a fruit tree in the springtime, you have the trunk, you have all the branches, and then at the end of all those branches form little buds, and those turn into cherries or apples or pears or mangoes or whatever type of tree we're talking about. Same thing in the human body. It's the trunk, the brain and the spinal cord, the 31 pairs of nerves branch out, just like the branches on the tree. And at the end of all of those branches grow the different organs, the different systems, kidneys, heart, lungs, liver, intestines, arms, legs. Everything grows out and sprouts out from that internal nervous system. Why? Well, nobody really knows, but what we believe is that the great creator created the brain and spinal cord first, and that is going to control and coordinate all functions in the body. That's right out of Gray's Anatomy. Okay, what does that have to do with Father's Day in 2023 on a beautiful Sunday afternoon here in New York City? Well, when the cranial bones, of which there are 22, when those cranial bones shift out of their normal alignment, which virtually happens on everyone, from physical, chemical, and emotional stresses, traumas, sports, bad posture, car accidents, falls, the physical side, the chemical side, what's in the air, what's in the water, what's the creams that you're putting on you, what's in the soaps, what's in the food, what's in the water, and the emotional stress, the problems at home, the problems on the job, the problems with relationships, the problems with money, all the things that we have to deal with every day. So we constantly have the physical, chemical, emotional stress. Let's talk about probably the original insult to the cranium, which is the birth process. So for Father's Day, here we go. The baby's head comes and passes through mom's birth canal, and as that's happening, the cranium of the baby, and I have my plastic model of a baby's head in Florida, the baby's head is getting compressed as it enters into the birth canal. So we have this compression. Then the head exits, and we have a decompression of the cranium and the cranial bones. And that is what's believed to truly kickstart this involuntary primary respiratory mechanism that was named over 100 years ago by Dr. William Sutherland, an American osteopath. So here we are 10, 20, 30, 40, 50, 60, 90 years up the line from the birth process. Cranium is distorted. Primary respiratory mechanism is moving. It's doing its best, but it's restricted. And this patient can't possibly function optimally. Whether you have symptoms or not doesn't really matter to me. If you came into me and I looked at you and I see, let me take the glasses off, and I see one eye smaller, one eye lower, ears rotated, one ear lower. I put my fingers under your cheeks, I see one cheek lower. I watch the way you talk, I see your jaw deviating maybe to one side. I see one shoulder higher than the other. I see one hip higher than the other. there's all distortion everywhere. And to me, it really began at the cranium. And so I'm going to unwind everything from the top down with the cranial release technique, this 1 minute technique, this 1 minute, very gentle, but very effective and very powerful technique. All I want to do as a chiropractor, and now to the next level as a cranial release technique practitioner, was to open, align, and restore the primary respiratory mechanism that's happening in the patient's own body. Remember, the first thing we learned in chiropractic was structure determines function. If the structure is good, the function's good. If the structure's off, the function will be off. That's just the way nature is. Structure determines function. So by working on the cranium of this patient, 10 years old, 10 months old, 90 years old, doesn't really matter to me. We're going to optimize structure and optimize function. It really gets as simple as that. It's really that simple. So, Father's Day, happy Father's Day to everyone out there. A great thing you can do for yourself and your loved ones is visit a cranial release technique practitioner. Get on the table and experience the work. Have a few sessions and see what your body feels like. If someone used to come into me when I was in active practice here in New York and I'd say, I don't know if this is going to help me because I suffer with X, Y, and Z. And I've been to everybody else. I would say, okay, fine. Come on in. Give me 10 visits. If at the end of 10 visits you don't feel any different, you're not aware of any changes in your body, if you're not aware, we're still friends. Let's call it a day. This is not for you. In almost 20 plus years of doing cranial release and almost 40 years as a chiropractor, I've never seen anybody come in that I told that to and after 10 visits say, I don't feel anything. Let's discontinue. No, they wanted to continue because they wanted to keep improving function. When you educate people about what this really is and keep it simple, when you keep it simple, people understand it, and then at the end of the day, they have to feel that it's the right thing for them. They will notice the difference. And if you do this technique, they will notice the difference. Sometimes in 1 visit, sometimes in 2 visits, sometimes 5, sometimes 7, but certainly before 10 visits, they will know a difference in their body. Something's changing, and it's changing for the better. If you're watching this on YouTube, please like, share, and subscribe. We're at 500 subscribers. We should be at 5 million subscribers, but one step at a time. Like, share, and subscribe, please, so we can send this work all over to your friends and family all over the planet. The website is cranialrelease.com. When you get a moment, jump over to the website, cranialrelease.com. Poke around, hit the buttons, order a free report for yourself. See if there's a practitioner in your area. And if you are a practitioner, maybe a chiropractor, maybe a medical doctor, maybe an osteopath, maybe a dentist, massage therapist, physical therapist, occupational therapist, and you would like to learn more about this from a practitioner standpoint, there's a button there called Online Training Program. Click on that button. Take a look over there. You'll see me again over there. We'll talk a little deeper at a different level. And then if this seems right for you, sign up. I'll see you on the inside pages, and we'll get into every aspect of how do you do this technique. I'm going to teach you step by step online how to do this. And then when you've completed the program of how to do the technique, how to do the testing for the technique, how to explain the technique, how to promote the technique in your community. If you have any other questions, we'll set up a time to talk via video call, audio call, however you want to do it, email, whatever works for you, doesn't matter. My only purpose here in making these videos is to get this work worldwide. It's global. I would explain this to patients all the time. The reason why your ankle feels better from cranial release is it's a global system. When we change something for the better, we change everything for the better. When someone comes in and says, hey, I can digest my food better, that's because we changed something up in here at the cranial level, and we changed the whole global system. This is a global system. If you pollute the air in one part of the planet, it affects the entire planet. It's a pretty simple concept. Nature knows best. Structure determines function. Cranial release improves function by improving structure. That's it. Happy Father's Day, everybody. See you down the road. This is Dr. Doreste, Cranial Release. Again, the website, cranialrelease.com. Adios, my friends. It's time for me to fire up a barbecue. I got a couple Brontosaurus steaks that I'm looking forward to chomping down on. Be well, everybody. Have a good day. Happy Father's Day. Adios.